Here we have two different patients with two different needs. Both need periodontal care, but the procedure and what we do to address their issues is different. This first patient has bone loss and very thin tissues. This patient may not necessarily have bone loss in between the teeth, but they've lost some bone that covers the surface of the teeth. This has caused recession in these areas. So in this situation, as you can see, the patient has lost the bone that goes in between the teeth, causing these little dark triangles. Unfortunately, because of the bone loss, we will not be able to cover the roots of these teeth. For this patient, they don't have those dark triangles between the teeth, and the gum tissue is actually there. So in this situation, we're going to go ahead and attempt to cover those roots. In deciding which procedure to do, we have to take into consideration what the patient has lost and what we're looking to gain. When we do what's called a free gingival graft versus a connective tissue graft, in the free gingival graft, we want to thicken out the gum tissue. In the connective tissue grafts, we are thickening out the tissue, and in most cases, we're going to go ahead and cover root surfaces as well. So as you can see in this situation where we're doing the free gingival graft, we take tissue from the patient and we transplant it in the area where they are deficient. In doing so, we get a nice thick band of what is called keratinized gingiva that helps thicken this area, preventing movement of the gum tissue off of the teeth and minimizing that bone loss that has happened for this patient over the years. In comparison to the previous patient, this patient, we decided to do what's called connective tissue grafts. We were able to cover the root surfaces that the patient had previously exposed. And by doing so, not only have we thicker gum tissue, but by covering the root surfaces, the patient minimizes getting any sensitivity or root caries, that's cavities on the root surfaces of these teeth. In conclusion, to show that there are two different types of gum grafts that these patients needed, but the end result is always to give patients something more stable that's going to keep their gum and bones healthier for a very long time.